We now move on to our next speaker, and that is Miss Arafa Said Salim. She is a sickle cell warrior and an advocate that is based at the sickle cell program, and we'll talk about the perspectives from patients and the role that she has played with the propagating the message of sickle cell. So Karibu Sana Arafa, and the floor is yours.
Oh, thank you so much, Mohammed. Hello.
Yes, you can proceed, Arafa.
Oh, you can hear me?
Yes, we hear you.
Okay. My name is Arafa, and I don't have any slides. Okay, I'll speak a little bit about myself. I was diagnosed with sickle cell disease when I was 8 months old after I was born. I have been fighting this since ever. As I've grown, I have seen a lot of misleading information circulating about sickle cell disease. Despite the advantages and advance in technology, there are still a lot of misunderstanding about the origins and misleading information. In some extreme cases, people even thought that this was an witchcraft. Because of this need of education in the community, I was compelled to found the sickle cell disease patient community of Tanzania in 2010. So I'm celebrating my 10 years of anniversary. As a sickle cell patient and an advocate, I'm determined to spread information and fight for accessibility of healthcare in Tanzania. I always believe that knowledge is indeed power. I'm creating awareness around sickle cell disease to eliminate the stigma and fight for patients' rights. Like every patient has to know what they're suffering and what is the treatment that is around and what they need to do. So myself as a patient, I took an initiative of saying that I'll stand on my shoe and speak about my disease for other patients. So everybody should know it and understand it. And I am glad that I'm working closely with the sickle cell program to make sure that we reach more patients, but not only patients, but also community. I believe that when the community understands something, they're the most people who will spread the awareness. Because when you talk about sickle cell and nobody knows about it, and many people thought it was a witchcraft, but now because of technology and a lot of awareness, we have a lot of people wanting to know more about sickle cell, but not only knowing about sickle cell, they would like to get tested, understand it more, and not only sickle cell. There's a lot of diseases that now we're advocating on, and we have a lot of advocacy on it, and many people are asking about it, and people are very willingly want to know more about it. So I believe that every let's say not every patient, but anybody who has the power of advocacy in any disease, anything, and work on it. Because I have been working on my sickle cell disease patient community over 10 years now. I have managed to execute several notable events in Tanzania that aim to bring more awareness and knowledge about the sickle cell disease, where we have different what we do as an advocate, WhatsApp groups, but we also have social media groups. And this helps us bring more awareness to the disease. So me and my team, we have been working on our biggest project is the confidence building and support campaign, where we talk to patients themselves to understand their disease and also bring their self-esteem, where person living with sickle cell used to believe that they cannot live to passing 18. But we believe that with the technology and awareness, many patients can live and have a peaceful life. And myself, I'm a mother, I'm a wife, so all this are done through advocacy. So I think whatever we're trying to do, first thing, advocacy awareness is very important, and this is where we come about. First thing we started with awareness. Yes. Yes, Mohammed. Any?
Thank you, Arafa. That was really, really great. Anybody with questions for Arafa, particularly now that you know she is a warrior, someone with sickle cell disease, and maybe you have questions regarding the disease itself and what she might be going through. So feel free to ask your questions to Arafa. Welcome. So we have a question in the chat box from Omari Mzava. Congratulations, Ms. Arafa, for the outstanding work you and the Sickle Cell Disease Patient Society have been doing in creating awareness. Can you briefly comment on some of the positive changes that you have seen over the years? Karibu, Arafa.
Thank you so much, Omar Mzava. There's a lot of positive change that we see. First, in community, people are asking more about the disease. Where can we get tested? What should we do? And how can we help these kids? How can we help our kids? And so there's a lot of positive change because people know about it and are questioning about it, and they want to know more about it. If there is more, like today we're talking about Tanzania Society of Human Genetics. So people want to know, is Tanzania going to come with a cure? Because everybody now knows about sickle cell, everybody's interested about it. But also through the government, we have seen with us advocating more on it, we are having a lot of clinics where before we only used to go to National Hospital, but now we have different places where people can get the treatment. Not only that, but also people are also asking on importance of them screening. So we have these things that because of advocacy, we are going further.